The Science on Tap series is taking a look at a very critical subject tonight. It's how poverty and discrimination can affect your health. Dr. F. Abram Franklin with the Multnomah County Health Department joins us in studio now. Welcome, Doctor. Thanks for being here.
Thank you for having me.
So a very important subject that you will be discussing at Science on Tap tonight. What exactly will you dive into?
Basically, the fundamental aim of the talk is or the presentation is to look at the role of race and class and how that sets up people for the opportunities for health, or the opportunities for health in a good way, or the opportunities for health in a bad way, and this sort of life course perspective on race, class, and poverty, and how that impacts outcomes.
You say Portland kind of falls in line nationally, so what do you find when you've done the research? How are people affected here?
Well, essentially, like similarly in other big states or metropolitan cities, race and class, poverty issues impact sort of the opportunities for resources and the opportunities, and health care being one of those resources, but not just health care, also education, employment, and economic opportunities. So they sort of set people up sort of where they can go and where they can't go.
Can you give us an example maybe of the difference in the health care available? You know, if you have something like a sore throat or an ear infection, how does what is available to those living in poverty to the rest of the population?
And that's kind of it's a big question, but it can vary. So sometimes poverty can be sort of geographically driven, and so people may not have access to primary care services, or people may have access to primary care services in terms of geography, but they may not have coverage. So again, sort of different dimensions of access. One is close, but neither is accessible.
So it is different then from when we live in a state that's very opposite from rural Eastern Oregon to here in Multnomah County. And you're saying the access
right.
Really
presents its own challenges.
Exactly. Similar means, but maybe similar outcomes, or similar ends, but different means.
What types of steps are being taken to sort of close that gap, and is that something you'll be discussing tonight? What are the options to change that? Well,
we'll be talking about some of the programs going on at the Public Health Division of the Multnomah County Health Department. Some of our programs focus specifically on Multnomah County, obviously, but they have applicability in other places, such as our Healthy Birth Initiative, which focuses on connecting pregnant mothers of African American descent or African American population to resources to ensure good birth outcomes for the child and for the family.
Do you find that sometimes once a person does get access to the medical care, they can have a serious situation that could have been caught much earlier on if they had that primary care physician?
Exactly. Many of the sources of morbidity or burdens on health are preventable, particularly as it relates to chronic disease, the impact of chronic diseases, as well as infectious disease. So it really pays to sort of have access and remove as many barriers as possible.
And I left out your title, but a long title, Director of Community Epidemiology Services. Give us a quick rundown of what epidemiology is exactly.
I get that all the time. So often they'll say whether it's a dermatologist, but actually epidemiology is just basically identifying the issues of the health burden, assessing the magnitude of the health burden in populations. And once you identify and quantify that magnitude, how is it distributed? And most importantly, ways to impact or intervene. What are the causes or determinants of health burdens in the population?
Well, you know, healthcare became a front topic during the Obama administration, where we had the Affordable Health Care Act. So in what you have studied, we better off than we were? I'm going to pick a day, 10 years ago. We better off today in terms of access, or about the same, or it's going the other direction? We're spiraling downward.
I'm sure depending on who gets this question, the answer will vary, but I would say yes. We are better off in terms of access, right. Are we as good as we could be? No, but we have taken some significant steps since 2008 to move in the right direction.
And it's good you're highlighting a subject like this tonight at Science on Tap. We want to give the public here information. It is tonight at 7 o'clock at the Alberta Rose Theater. We do have a link to that on our Portland Today Facebook page, so you can find out all of that information there. And again, we want to thank Dr. F. Abram Franklin with Multnomah County Health Department for speaking on this subject.
Thank you.
Thanks for being here.
My pleasure.
Let's move along.